Hello, this is Marla Dalton, Executive Director and CEO of the National Foundation for Infectious Diseases, or NFID. The Centers for Disease Control and Prevention, CDC, now recommends COVID-19 booster doses for certain populations who received the Pfizer-BioNTech vaccine series, including older adults, residents in long-term care settings, those with certain underlying medical conditions, and others whose occupations put them at risk, including healthcare professionals. With the Delta variant surging and cases of COVID-19 on the rise across the U.S., experts believe that a booster dose will help provide continued protection against severe disease. At the same time, CDC advisors emphasize that the populations most vulnerable to COVID-19 are those who remain unvaccinated. With flu season approaching, getting everyone fully vaccinated against both COVID-19 and flu will be even more important. With me today is NFID Medical Director, Dr. William Schaffner, to help explain the updated CDC guidance on COVID-19 vaccines. Bill, always a pleasure to have you.
Good to be with you, Marla.
Bill, CDC now recommends that certain groups should receive a booster dose of the COVID-19 vaccine by Pfizer-BioNTech, while others may do so. What is the difference, and who is now eligible?
Well, it is a tad confusing, but let's walk through it. First, just to re-emphasize what you've said, the people who are eligible for boosters received the Pfizer vaccine, and it's been 6 months since their second dose. So who ought to receive the vaccine? First of all, it's pretty easy. People age 65 and older. Remember, they were among the very first to receive the vaccine, so it's been the longest duration since the end of their series. And then people who are age 50 to 65 who have underlying illnesses such as heart disease, any kind of lung disease, diabetes. If you're obese, for example, those individuals are more at risk of getting the severe complications, so they should get the booster. Now, that said, who may get the booster? And this has a sense of the person determining whether their potential benefits are more than any side effects associated with the vaccine, and they may wish to discuss this with their healthcare provider. We're working down the age range. You may receive the booster vaccine if you're between 18 and 49 and have one of those underlying illnesses. And then anyone who works or lives in a circumstance that puts them in regular, constant contact with people who might be infected. This is a very broad category. It does include healthcare workers, people who work in schools or grocery stores, or people who live in congregate settings. Prisons have been mentioned, for example. Now, this last particularly is in early days being interpreted either broadly or in a more restrictive way. I actually have a friend who says that if you interpret this last recommendation, this living in a circumstance or having an occupation that puts you in large contact with people, you'd have to be a hermit not to qualify. That may be a little bit extreme, but it does refer to so-called frontline workers, people who work in restaurants and retail establishments may wish to determine if they've received the Pfizer vaccine and it's been 6 months since their last dose, whether they would like to receive the booster.
Very helpful. So I guess on the minds of many is, when can those who are not in one of those recommended groups receive a booster vaccine? And frankly, what about those who received Moderna or the J&J vaccines?
Yeah, that's very specific. Those companies are in the process of submitting their data to the Food and Drug Administration. We would anticipate that in the next several weeks, those individuals also, if it's been time since their second dose, would be eligible for the vaccine. I said second dose. Actually, for the J&J vaccine, that would be their first dose. Another question is whether you can, as we say, mix and match. Suppose you've had Pfizer, can you then get Moderna or reverse, or should the J&J folks get one of the mRNA vaccines? We'll have to wait for the CDC to give us their recommendations. The CDC committee wants to make sure that there are sufficient data about the effectiveness of all these regimens and their safety before they recommend them for general use in the larger population.
So, Bill, why are booster doses even needed? Does it mean that the vaccines are no longer working?
Well, actually, there's been a fair amount of debate about whether booster doses are needed, and there's a little bit of an analogy. Just as we say, beauty is in the eye of the beholder, there are some scientists and public health officials who are really strong advocates of boosters, and others who approach it more with, shall I say, a rifle rather than a shotgun. But in general, first, let's emphasize that these vaccines continue to be very effective in keeping the vast majority of people safe from the more severe disease that requires hospitalization for COVID. Now, that said, and here's the issue, there are several studies that would indicate that antibody is indeed declining with time, particularly for older people. And there are also some data to suggest that the level of protection against severe disease, again, particularly among older people, is diminishing somewhat. And therefore, the interest in getting boosters into everybody to prevent further diminution in protection.
So interestingly, there seems to be a distinction between boosters and third doses now. Can you explain that?
This is pretty nuanced, Marla. Boosters are given to people with reasonably normally functioning immune systems. They got their initial 2 or 1 dose, and their immune system responded, but over time, their protection, as I was just saying, began to wane. You give them another dose of vaccine, which will boost that antibody response. It will go up very quickly, even higher than they first achieved, and that will have the advantage of longer protection, we think, and better protection against the variants. That's the booster. Third dose. That has to do with individuals who are immune compromised to a very substantial degree. To whom am I referring? People who are receiving active cancer treatment, those who've received an organ transplant or a stem cell transplant. If you're taking very high dose corticosteroids, most of those people know that they're immune compromised. They've been educated about that. If there's any question, well, they should ask their provider. Those folks, the immunocompromised folks, didn't respond optimally to the first 2 doses. So we're saying at any time after their second dose, they should get another dose, a third dose. We can think of that as part of their primary series. I hope that's not too confusing.
No, very.
Booster versus third dose.
Very helpful. So shifting gears just a bit, there's also been some confusion about co-administration with other vaccines. So for example, is it safe to get a COVID-19 vaccine at the same time as a flu vaccine? And what about other recommended vaccines?
Well, to answer your questions quite specifically, it is safe to get COVID vaccine and flu vaccine at the same time, whether the COVID vaccine is first, second, third dose, or booster. Yes, you can do that. A bit of historical background, not to go back too far, but initially, when COVID vaccine was released into the general population, everyone CDC in particular, and the Food and Drug Administration, wanted to know about the side effects of COVID vaccine once it was used in the general population. We knew a lot from the clinical trials, but we all knew that when you use it in the real world, new things may crop up. And therefore, at that time, it was recommended that you not receive a vaccine either 2 weeks before or 2 weeks after receiving COVID vaccine. We didn't want to confuse the data. We now know all about that. We know about the safety. And so the CDC has now said, yes, you can receive COVID vaccine simultaneously, concurrently with any other vaccine. You'll get one in one arm, one in another. And somewhat facetiously, I remind people if they are going to get their COVID vaccine in one arm and flu vaccine in the other, don't sign up to do a lot of weightlifting the next day. You may have a couple of sore arms, but that will pass and the protection is worth it.
Absolutely. So CDC has made it very clear that the priority now should remain on getting everyone fully vaccinated with a primary series. So why is that so important, and what can we do to sway those who may still be on the fence?
Yeah, I'll answer the first question. I'm not so sure I know the answer to the second, I'm afraid. But obviously, people who remain unvaccinated are the group in which COVID virus continues to spread. You know, well over 90% of the people who are admitted to the hospital for COVID right here across the street at Vanderbilt are unvaccinated. And this is true in hospitals and medical centers across the country. So this virus is spreading among the unvaccinated, making many of those folks sick, and it's spilling over into causing milder breakthrough infections in the vaccinated population. If we could just increase vaccination among the unvaccinated, then COVID's spread would be substantially diminished, and we could then say, yes, we're really controlling this pandemic to the best degree that we can. So we need to get our neighbors and friends who are still skeptical, hesitant, or, as I have to acknowledge, sometimes downright stubborn, to get them vaccinated to help our entire communities across the country be better protected. You know, we've had a lot of concern about school children going to school in as low risk a fashion as possible. Well, the best way to do that is to have all the adults in the community vaccinated. Then the virus is not circulating, and children, whether they stay at home or go to school, will be much safer.
From your mouth. So, Bill, before we sign off today, is there anything else that our listeners should know?
Well, to borrow a phrase from Hemingway, COVID is a movable feast. There's always something new down the road. The Moderna and J&J people have supplied their data for boosters. We'll see about that. Pfizer has data in for children from 5 to 11, so there'll always be something new with COVID down the road. We need to stay tuned and up to date.
Bill, thanks again, as always, for your extremely valuable insights. We'll certainly look forward to continued discussions on a future episode of the Schaffner Report. Have a wonderful day.
My pleasure.